Okay, this one is one of the final techniques for this course. We're going to look at releasing the psoas, one of the deeper core muscles, extremely important to release the psoas. It has a lot to do with low back pain. As we see with this model, here's the psoas running down the spine, lumbar spine, and attaching onto the inside of the hip. So we move this around here. Here's the attachments. Now, with this particular technique, I'm going to give you some cautions. I would highly recommend not releasing below the anterior superior iliac spine, because we can get into the femoral triangle and a weaker area of fascia. That's a high recommendation for a caution. What I generally do is release about this much of the tissue. I come up, I'm slightly engaging it, and going back and forth. So I'm going to landmark. Here's the anterior superior iliac spine. I'm going to move slightly over and up. And what I'm going to do to make sure I'm on the psoas is I'm going to raise Paula's leg up. I'm going to let you relax your leg, Paula, for me. And just let the whole leg go. Great. Landmark the area, move over. And when Paula has her leg relaxed, as she does right now, I'm just going to sink in gently. And what I'm going to have Paula do is actually hold her own leg up. So hold your leg up now, Paula. Immediately what you're going to find is that psoas is going to pop right into your fingertips. You should feel it exactly. If you don't, just move slightly towards the midline and then do the movement again. So you have the client relax their leg, press in, and then have them hold their leg up. And then you'll feel a pop in your hand. So now relax, Paula. Great. So I'm going to landmark. I'm going to sink in just where I feel the psoas. Now what I'm going to have Paula do is she's going to hold her leg up. I'm simply holding onto the area, and Paula is slowly going to take her leg, put it on the table, nice and gentle and slow. And I'm just engaging the fascia. And breathe. And this can be very tender, so keep in contact with your client. And then just relax, Paula. Great. I'm going to engage the tissue. Press in. I'm going to have Paula hold her leg up. She does. I feel the psoas. Paula relaxes her leg. Now what I'm going to have Paula do is more in an advanced movement. Not only am I going to have her actually take her leg down the table, but I'm also going to have her reach with her arm over her head. And she's going to use her right arm. So I'm going to engage the tissue now, and she's going to do that reach as well as taking the leg down the table. So you can see that whole movement, that whole shearing effect of that tissue. We're really getting the whole plane here. And breathe in and out. Spend a couple minutes with the psoas. You don't want to do a lot of work because it's a deep core muscle. Guidelines, once again, keep superior to the anterior superior iliac spine. You do not want to go into the femoral triangle. And relax.